Hey guys, welcome back, and today we are going to discuss about other nursing diagnosis and care plan on excess fluid volume. So if your patient condition is excess fluid volume, okay, means how you will write the nursing diagnosis. So you can see the nursing diagnosis here. Excess fluid volume related to compromised renal function, example like chronic kidney disease, as evidenced by edema, decreased urine output, and elevated serum creatinine level. So you have to check the case sheet of your patient, or you have to understand what's the condition of your patient. Then only you have to write, or you can write the nursing diagnosis, especially in this condition, excess fluid volume. Okay, excess fluid volume related to directly you can write chronic kidney disease or compromised renal function as evidenced by edema, decreased urine output, and elevated serum creatinine level. Another nursing diagnosis, excess fluid volume related to heart failure as evidenced by pulmonary crackers, dyspnea, and weight gain. So if heart failure also can lead to excess fluid volume. Then next nursing diagnosis, excess fluid volume related to excessive sodium intake as evidenced by hypertension, peripheral edema, and jugular vein distension. So excessive sodium, salt intake also can lead to excessive fluid amount in the body or excess fluid volume in the body. Then liver cirrhosis also can lead to excess fluid volume. So you can write excess fluid volume related to liver cirrhosis as evidenced by ascites, that means pus formations, peripheral edema, and increased abdominal gut. So these are all the nursing diagnoses or some examples for nursing diagnosis. Always try to understand the condition of your patient and the symptoms of your patient. Then you write your nursing diagnosis. Then we will see what is excess fluid volume. What is excess fluid volume means an increase in the isotonic fluid retention in the body tissues, resulting in swelling, weight gain, and other clinical symptoms. Fluid less also a problem, more fluid or excess fluid also a problem. So whatever it is, we need a balance, right? Then we can write excess fluid volume related to heart failure. So I'm just telling the reason, some etiological factors or risk factors of excess fluid volume. Heart failure is a reason for excess fluid volume. Then cirrhosis of liver is a reason. Then fluid overload from IV therapy, in intravenous therapy, okay, infusion. Then blood transfusion also sometimes can lead to excess fluid volume in the body. Then medications like corticosteroids, if we take, means there are chances of accumulation of fluid and can lead to swelling, weight gain, etc. And what kind of symptoms we could see in the patient means edema. What is edema? Swelling. Okay, swelling in the extremities especially, then face and abdomen. Then sudden weight gain will occur, like more than 2 lbs in 24 hours. Then dyspnea or shortness of breath. Increased blood pressure, jugular vein distension, decreased urine output, and fatigue or weakness. So these are all the common basic symptoms of excess fluid volume condition. Now we will see the nursing care plan. While writing your nursing care plan, please follow this format: assessment, diagnosis, planning, rational implementation, and evaluation. In assessment, two things we will write: subjective data and objective data. In subjective data, what you will write? What is your patient complaints and what they are saying about the situation. That is subjective data. That is subject's data. Subject is who? Patient is your subject, right? So subjective data means what is your patient's complaints. Objective data means for you, patient is your object, right? So what you have observed from your patient, what you have seen from your patient's situation, that is objective data. So in subjective data, you can write the patient complains that she or he got edema in leg, breathing difficulty, and weight gain. Sometimes they don't say edema, they will say swelling. Okay, sometimes if they know the medical terminology, they'll say edema. So the patient complains that he or she got edema or swelling in the leg, breathing difficulty, and weight gain. They will say like I have shortness of breath and my suddenly drastically my weight is gaining. Okay. Then objective data. The patient looks very tired, obese, and evidence of hypertension and edema. That is your observation. Or if we are taking the information from the case sheet, you will clearly see the signs and symptoms of the patients in the case sheet. Then diagnosis. So next column is diagnosis. You can write the diagnosis depend upon the condition. I didn't write the diagnosis here because it depends upon the condition of your patient. Then goal. The patient's fluid balance will be maintained or improved. Edema will decrease and the patient will experience less shortness of breath. So everything will be future tense. Will be, will, will balance, will maintain, will be maintained, will be decrease or will decrease. Okay, will experience less shortness of breath. So always in future tense you write your goal because that is your goal. Then next column is planning. Next is rational. Next is implementation. Planning always you can write in the present tense because you are going to do that. So it should be in present. Then you can start your rational with to. Okay. Then implementation in the past tense because you have completed it already. So do means done. Yes. Then first planning is do history collection and physical examination. Almost all the care plan, I'm keep on repeating the same thing. While writing your nursing care plan, always you start your nursing care plan with history collection and physical examination. That is the basic fundamental or keystone or milestone or the building block of your care plan. Do history collection and physical examination. For what? To understand the general condition of the patient. Implementation, done history collection and physical examination. Second planning, monitor vital signs. That's very important in excess fluid volume. For what? To understand the variations in vitals, temperature, pulse, respirations, oxygen saturation, etc. Then in implementation, monitor the vital signs and recorded it. Next planning. Assess and monitor the signs of fluid overload. Assess and monitor the signs of fluid overload. You can check the lab result for that. Okay. Then what is rational? To identify and track fluid volume status. Implementation assess for signs of fluid overload such as weight gain, edema, shortness of breath, crackles in the lungs. So you will get from the lab result. At the same time you can see from the basic general situation of the patient. Weight gain, edema, shortness of breath, crackles in the lungs means what? Excess fluid volume is there in the patient's body. The next planning, monitor lab results. Very important to understand the electrolyte levels in the body. Monitored and observe for serum electrolytes. Okay, sodium, potassium, and calcium. Okay, so you have to observe all these things. Electrolytes you have to observe properly. Then blood urea nitrogen, herbane or creatinine. So you have to observe all these things compulsory. So in the implementation, you can write monitored and what are all the things you observed or what you have seen in the lab result that you have to write in the implementation column. The next planning, administer medication as prescribed. It's very important. Normally in the care plan, I'm writing administer medication at last because that is not nursing plan, right? But in this condition, administer medication is very important because sometimes, without giving medication, the excess fluid volume will not come down because of reason might be bit serious thing like heart disease or liver disease or any other diseases. Okay, then what is the rationale? To remove excess fluid. Then what is the implementation? Administer diuretics like we had furosemide said whatever. Okay, whatever the diuretics. So administer diuretics or administer medication as per the doctor's order. That you can write. Then next planning, monitor for signs of dehydration or electrolyte imbalance again. Okay, for what? To prevent the complication. Monitored, especially potassium loss. Especially potassium loss you have to observe in the case sheet, in the lab sheet. Then next, focus fluid and dietary restriction. Focus fluid, how much fluid the patient is drinking or what is the intake of fluid, and what kind of diet they are taking, like excess sodium contained diet or not. For what? To prevent the further fluid retention. Focused and plan the dietary intake. Focused and plan the dietary intake. You can plan the dietary intake and you can develop a chart and you can talk to the dietitian, okay, and can create a diet plan to prevent the excessive intake of the sodium or the food which create excess fluid volume in the body. Then next, restrict fluid intake based on the patient's condition. Very important. Normally we'll tell increase the fluid intake, but in this case excess fluid volume in the body, so restrict the fluid intake based on the patient's condition. Okay, so there is a amount you can see in this slide, commonly 1500 to 2000 milliliter per day. Okay, for what? To prevent the excess fluid in the body. Implementation, restricted and started to focus on intake. Very important thing. Then follow sodium restricted diet. If the patient is showing excess fluid volume is because of excessive sodium intake. Means what you are supposed to do, you have to reduce the sodium intake. In other conditions also you have to reduce the sodium intake. Heart failure, sodium intake. Liver cirrhosis, sodium intake. Any other disease condition, sodium intake. So you can simply write that, directly you write follow sodium restricted diet to prevent the electrolyte imbalance. Followed and encourage low sodium foods, typically 2 gram per day or less. 2 gram per day or less. Then instruct the patient and family about the importance of adhering to fluid and dietary restrictions. Sometimes, lack of awareness might be a reason behind this excess fluid volume that can precipitate the complications. So, instruct the patient and family about the importance of adhere to fluid and dietary restriction. For what? To create an awareness. Implementation instructed the patient and family. Sometimes, visual learning material will give more what effect than the auditory thing. Different type of learners we have, so you can show some videos. If you take excess sodium, okay, if you are taking this type of food, if your food habit is what can happen at last. And sometimes if there is any chance, even role play also you can do, so that will easily get stick into the brain. Okay, so you have to give these instructions to both the family as well as the patient. Then promote activity and mobilization. It's very, 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 very important. The patient is not bedridden, guys. Depend upon the situation of the patient to promote circulation and reduce edema. If you keep on giving pressure on area, keep on sitting, keep on lying down on a bed, means definitely edema will increase. The severity of edema will increase. So to prevent that, as well as to promote the circulation, you have to promote activity and mobilization. Promoted and elevated affected extremities. Okay, for example, like in one extremity only the edema, means you can elevate that extremity, like moving, changing the position, that can reduce the severity of edema. Then encourage ambulation and physical activity based on the patient's condition. For what? To reduce the edema. Encourage active or passive range of motion exercise if the patient is bedridden, to prevent venous stasis and reduce edema. Guys, like if we sit for a quite long time in a place, we start getting a numbness in the leg, and sometimes edema will develop. It's because of what? Lack of blood circulation to that specific part of your body. Especially in this condition, if you are not moving your body, they're not doing any physical activity, the severity of edema will increase. So in that case, what we can do, you can do passive actions if the patient is bedridden. Okay, for what? To prevent the venous stasis, venous blood stasis. Okay, venous stasis, and reduce the edema. And then provide educational and psychological support. Provide educational psychological support. For what? To empower the patient with knowledge about managing their condition. Psychological support is very, very important. In all care plan, you can write psychological support, emotional support, because that matters a lot. Okay, then educated and patient to monitor signs and symptoms and recognize early signs of fluid volume overload, sudden weight gain, increased edema, difficulty in breathing. Like you can educate. If you feel breathing difficulty, if you are feeling like you are increasing your weight, you are putting weight, or if you are feeling some breathing difficulty, means please don't hesitate to communicate with your practitioner or doctor or nurse or the nurse practitioner or whoever giving health professionals or pharmacist who is giving care. Then tell about the follow-up care. It's really very important. Tell about follow-up care. I'm telling it's very important. It's very important in all the planning, because it is really important. That's what I'm saying. Tell about the follow-up care to reinforce the need for regular monitoring and medication compliance. Discussed about the follow-up in detail. Then provide emotional support, okay, to reduce the anxiety or frustrations related to the chronic condition and frequent hospitalization. For example, like liver cirrhosis is the reason behind this excess fluid volume, or heart failure is the reason behind this excess fluid volume. Means definitely they have to do frequent visit to the hospital, and that can create a fluctuation or imbalance in their mental health. So emotional support is very necessary to overcome this situation. Then provided emotional support to the patient by reinforcing the confidence. Then what is evaluation? You just go back to your goal and check what is your goal. So from that goal, you can develop your evaluation. The patient's fluid balance was maintained or improved. Edema decreased, and the patients experienced less shortness of breath. That is the evaluation. All right, guys. So this is the nursing diagnosis and care plan for excess fluid volume. And hope you understand, guys. And next time with the next or another nursing diagnosis and care plan. Okay, guys. Bye bye.